Hi everyone, my name is Melissa Issa-Boube, and now I'm in Malawi for my research year. My family is originally from Niger in West Africa. My mom connected me with physicians in the area, so I got to see how healthcare was practiced in Niger, and those experiences illuminated the disparity. Health opportunities that I've been engaged in while here at MSM include the creation of GIG, which Jenny and I co-founded during our first year. We worked with MedShare, Books for Africa, we worked with Jolly Garden, we worked with Meals on Wheels, and also at the same time trying to find global opportunities for students. So I was able to apply for the Fogarty Fellowship and travel to a country for an entire year to carry out a project related to global health in a low-income resource country. Jenny, on the other hand, she's in India now, and so she's taking part in the India Way electives. Here in Malawi, my project is looking at the gap between the amount of blood that is requested by the clinician and the amount of blood that the patient actually receives. So the hardest part about working in Malawi is experiencing firsthand the disparities and seeing how healthcare is practiced. The only difference between me and the patients is that I just happen to be born in a different place. This makes me mindful about how healthcare is practiced and what I can personally do to change healthcare practices that better benefit patients without implementing my own views that have been trained in a different healthcare system and adapting what I learned to better fit the patients that are in this context. This impacts my understanding of global health equity because I remember a physician saying that if you vaccinate an entire village but children are still dying of malnutrition, have you done your job? And so it makes me think about the work that I do. Is it sustainable? Is it helpful even? I don't want my temporary position to negatively impact the populations when I leave. To make sure that these initiatives are action-based, and I mentioned how GIG was very adamant about making sure that we have at least one volunteer event a month. The real work and the real impact happens when you're actually on the ground and in the community and doing the work. So lastly, we can't talk about global health traveling without discussing the cost. So I know that finances are a barrier for many students, and if we are able to remove that barrier, at least minimize that barrier for students, I know that that will encourage more people to go and engage. I have to join GIG because GIG is a great liaison between the student body and the faculty that engage in global health here at MSM. I say that GIG has led to me being in Malawi here today. I would encourage students to take risks. I'm sure you can imagine that my parents were not too enthused about me extending my medical education for another year, but once they found out the reason and the purpose, they knew that this was on brand for me, and it's really broadened my world about what is possible and what is not possible in the short term. And so it's given me a much more realistic picture of what I can do as a surgeon. The hopes that I have for a global health education at MSM, more students going to the away electives that currently are in India, but it would be great to also have something available in sub-Saharan Africa or South America for students. I would also like to see global health addressed in our community health course, and I would like to thank the David Satcher Global Health Equity Institute for all of your support. Thank you so much for having me. I'm glad to be able to participate in this summit all the way across the world.